Working 37 years as an electrician, Greg Horn knows how vital his hands are to his work.
It's a not even just job, just everything in life, just to do. Yeah, that what's makes your living is the hands, I guess.
But for the last decade, there's been a little more electrical tingling on the job. And we're not talking about the wires.
So Greg came in, as a lot of patients do, with numbness and tingling in the hand.
Just like your hand falls asleep or whatever, tingling in the fingers and that kind of stuff.
We diagnosed him based on exam, and also we get a nerve study that shows that he did have carpal tunnel syndrome. And so we talked about the options of treatment.
They did mention a shot, and that would only be last for so long and so many times.
And so we talked about surgery.
Patients now have a broader selection of choice for their surgical repair. There's the traditional surgery, a wide awake option in the clinic, or a third minimally invasive procedure.
One of the options we have is an endoscopic approach, and that's what I prefer. And the nice thing about that is, instead of, the carpal tunnel really goes from the palm here, really up to the wrist area. And so back in the day when we started doing these, before my time, we used to have big incisions that would go all along the wrist. Patients would need a long time to recover, and they would even be immobilized in some cases, so you get stiff and things like that. Now we can do it endoscopic, which again is my preferred technique, where you have a small incision here at the wrist, and through that, with a special instrument and a camera, we can actually release all the way down and all the way up here. So we'll release that same entire area of the carpal tunnel that's putting pressure on the nerve, but we can do it through that small incision. The nice thing about that is, smaller incision, less pain, quicker recovery. I've had patients who are generally very happy with that approach.
One of those patients is Greg, who is wishing he would have listened to his body a little sooner.
I wouldn't put it off too long. I work with a lot of different guys that have had the issues over the years, and it seems like the sooner you catch it, the better those people have return. I would say as soon as you think you have it, start seeing somebody about it. So.
In terms of surgical care for carpal tunnel pain, there's no right or wrong choice. It's just another tool for surgeons to tailor care around each patient.
Depending on the exact pathology and whether they've had previous surgery and kind of their expectations and what they'd like to get back to, we do tailor it quite a bit. So I think it's just, it becomes, after the general points, it really becomes a discussion with each individual.
With a smaller scar on the wrist, rather than the palm, Greg is ready to get back fully to life, just 2 weeks after surgery.
Good, very good. Yeah, everything's, I know, no sleepless nights and stuff, so it worked out good.